Right.
All right. Well, happy Thursday, everyone. This 27th of June, 2024. My name is Nicholas Nelson. I'm the Public Health Outreach Coordinator here at the Texas Center for Disability Studies, and I'm also the Public Health Outreach Coordinator for the Texas Technology Access Program. So we're here today to talk about a very important topic that people may not know about. And if you want in the chat, you can put your name and where you're from and what your title is at your work. Nice to meet you, Maria. Thanks for being here today. But yeah, we're going to talk about a very important topic today. The topic is telehealth. This telehealth presentation is mostly geared towards patients, but providers can glean useful information from this as well. So thank you again for being here. I know more folks will join as they go. So I'm going to share my screen. There we go. I got share sound. All right. Just turning on some settings real quick. Looking for the chat. I don't think I can pull up the chat, but I have people watching it. So can everyone see it, the presentation?
Yes.
Perfect. Thank you, Cole. All right, so Telehealth 101, empowering patients. I know I have you from 10 a.m. until 11:45, but we won't go that far. We'll probably go for like the whole hour, and then we'll have some time for discussion afterwards. So this is a collaboration between the Texas Center for Disability Studies and the Texas Technology Access Program. These are our contacts and disclosures. I'm not going to go through them, but you can, once I send the PowerPoint after this presentation, you can definitely take a look at all that. This is just our financial and non-financial disclosures. And yeah, this is the Texas Technology Access Program. Let me let someone in right now. So the mission to increase access for people with disabilities to assistive technology that provides more control over their immediate environments and enhanced ability to function independently. Below, you'll find our website that's hot linked and also the website spelled out. So please go and check our website. So today's learning objectives. By the end of the session, we hope that everyone here, the participants, will be able to create a plan for implementing telehealth best practices, list 3 accessible and inclusive telehealth features, and then also identify up to 5 items needed for a telehealth visit. So being apps, devices, software, equipment, just some hints of what to come. This is our introduction to telehealth, just to kind of give a blanket statement about what telehealth is, what it isn't. Telehealth is healthcare that is provided without an in-person visit, office visit. It's conducted primarily online with internet access on a phone, computer, tablet, or smartphone. I also just want to mention that there's also telemedicine that's mentioned. Telemedicine and telehealth are often interchangeable or interchangeably used, but they do have a distinction in that telemedicine is actually a subset of telehealth. Telehealth is different from telemedicine because it refers to a broader scope of remote healthcare services than telemedicine. Telemedicine is a little more specific in its services. So that's just kind of we're splitting hairs, but it does make a difference. So in the chat, if you could, this is just a few questions for the audience. When do you think telehealth was first used? It might surprise you. Just take a wild guess, and I'll let that kind of marinate a little bit. But the other questions for you to answer, if you would like, just have you ever tried telehealth? Did it ever work for you? In what ways, in what health situations would you consider using telehealth? And then also, do you know people that may benefit from telehealth, that maybe your family or a friend or somebody that you know that has a disability that isn't able to go out to places? It could be X, Y, and Z. So let me know in the chat, please. While that's going, I am going to reveal the answer to the first question. So telehealth first started like in the beginnings at around 1940s, but it wasn't until like the 50s and the 60s where they were able to like fully have a telehealth visit where they were able to transfer information. The first people to use video communication for medical purposes, they were clinicians at the University of Nebraska. This was in 1959, and they established a two-way television setup. So kind of old school, very different than what we have with computers nowadays, or just even our phones. I mean, it's a whole universe in the palm of our hand. So yeah, that was their way of transferring information, which is, I think, pretty cool. So, and thank you to everyone that did answer in the chat. Let's see. Oh, actually, here we go. Yeah, so perhaps early 2010s, the pandemic. Hilda says 2020 during the pandemia. Yeah, so lots of answers. Cole's used it for therapy. I use telehealth visits for my therapy appointments. Hilda loves telehealth, scheduling around work and other commitments. That is a super flexibility option for telehealth. We'll find out later that that's the benefit, like that's the best part of it is you can be anywhere theoretically and do a telehealth visit with the provider. So, and Cole says he really enjoys the convenience. I do too. All right, so moving on, we're going to talk about the benefits of telehealth. This is to provide like an overall structure of what you're going to be engaging with today. We're going to talk about an overview of telehealth. We're going to talk about broadband funding, which for folks that don't understand broadband, high-speed internet access. We're also going to talk about insurance. We're going to talk about accessibility. We're going to talk about assistive technology, and also we're going to talk about resources at the end. All right, so the state of telehealth today. Why are we talking about telehealth? Where did it come from? Why is it so important nowadays to us? There's many reasons that people have already answered in the chat, but it was during the pandemic. The public health emergency started. People weren't able to leave their homes. They couldn't access in-person services. And overall, just like negative health outcomes, as you all already know, were happening during the pandemic, and they only increased during the pandemic when healthcare support was most needed. There wasn't that access piece. And we saw this a lot with broadband access as well. Like people weren't able to get to online services because they lacked internet services entirely. So I will talk a little bit more about that. All right, and then the benefits. So these are the best parts about telehealth. Telehealth enables access. It really, again, like I was saying, you virtually can do it anywhere in the world. I do it like I can wake up, have a cup of coffee, and then talk to my therapist right afterwards. It's very convenient, very straightforward, very streamlined. If you're able to have all of your ducks in a row, they're not many, but they are important pieces, and you need every one of them to get going. So many types of professionals can offer services via telehealth, no transportation, potentially shorter wait times between appointments. There's telehealth services that can be asynchronous that I'll talk a little bit later. The best part, less exposure to communicable diseases. So again, during the pandemic, that was a perfect option for us to not go out, not be interacting with people as much as we wanted to, we weren't able to. So this was a the perfect option. Not maybe the most optimal option for people, because like I was talking about earlier, not everyone was able to access it. Diminishes urban-rural divide. We'll talk about that again. Broadband access, inclusive care for socioeconomically disadvantaged folks. It really getting quality care is built into certain laws that we have now, and that access piece again delivers quality care to the hardest to reach. And finally, economically more viable and cost-effective for patients, which is a big plus for all of us. And then to talk about the negatives, the barriers, what is preventing telehealth from being universally accepted nowadays. It's in most regards inaccessible. There are parts, again, that do enable access, but again, there are parts that you need to get set up and people don't have access to those. It needs tons of preparation. You need to do your homework. We'll talk a little bit more about that. Inconsistent, just like we've done Zoom rooms for the last 4 or 5 years, there's inconsistencies in technologies and updates that are needed. I can't tell you how many times I've joined a webinar and I've had to download an update for Zoom only to join a few minutes later and be a little bit late. Those things happen. It's the bugs and just the mishaps that can happen with technology. It's not perfect by any means. Limited subsidy equity programs providing telemedicine resources. This will be talked about a little bit more. During the pandemic, there was a lot of resources that were put in the pandemic. During the pandemic, there were a lot of equity programs that were available for patients and people across the United States. But those programs have kind of faded. Some have been just lost in funding entirely, and they're less frequent nowadays. And then also professional licensing across state lines. This can differ depending on where you're at and depending on the insurance that you have. It really can differ with each provider and, again, what your insurance can pay for. So talking about Texas specifically, this is what I was talking about earlier in terms of broadband access. This is the Texas Digital Opportunity Hub. Right now, there's a big inversion of federal money that's coming into Texas. It's the BEAD program, and it's looking at providing billions of dollars for broadband access and infrastructure in Texas. And this is just to show you a little bit of why it's needed. Internet adoption refers to full access. So when they're talking about that, persons have full access no matter what in their home for everyday life needs and goals. And right now, 31% of Texan households do not subscribe to high speed internet at their home. So that's a third of the population of the second largest state in the entire United States. So that's a huge percentage of people. And you can see where more folks are, where there are dearths of internet access compared to others. The main metro areas, Dallas, Austin, San Antonio, Houston, those are mostly well connected in Corpus Christi. But then you look at East Texas a lot, and it's very, very prevalent, the lack of access. And then also if you go westbound, there you can see that there's a lack of access until you get to El Paso. So it's just, and down in the valley. It's all over, but mostly concentrated in the eastern part of Texas. And it just goes to show that it's not equal. The distribution and the equity is a little bit askew. And then this is talking about the importance of broadband access in general, just how the difference that it can make. Access to quality prevention and prevention-based healthcare is a cornerstone of public health. Because of certain restrictions and barriers within healthcare, about 20% of adults do not get the necessary services that they need within healthcare. And then this is an initiative that was done by the Southern Rural Black Women's Initiative in partnership with the Institute for Local Self-Reliance Community Board Broadband Networks. It's a telehealth case study, and it was done on 10 southern rural counties. And what happened was detailing how all the universal affordable broadband infrastructure, how the return on investments was about $43 million per year across these 10 counties. It also this was the Black Belt. This is considered the Black Belt of the United States. And it's just helping rural communities get connected in ways that they probably wouldn't have without these initiatives. Just a great little piece that I think really highlights the importance of telehealth, especially in rural communities. All right. So the biggest piece of this all is legislation. I talk about it intermittently throughout this presentation, but I think it needs to be said up front, like what is the current legislation around telehealth? The Biden administration, at least for the fiscal year 2025 budget, there's about $40 million of funding set aside for HRSA and their telehealth program. and then also for telehealth research within cancer at the National Cancer Institute. These are just proposals to increase broadband statewide or countrywide. And then also the BEAD program is looking at the broadband infrastructure access. And in my notes that I have here, once I send the presentation, there's a ton of other legislation that's related throughout the years to telehealth. So I encourage you to look at the notes and see what the current legislation is and what the past legislation was, and see how it's developed through time. All right, so let's get to the nitty-gritty of it all. We're first starting off what I think is like the first roadblock needed to get over to access telehealth, and then we'll eventually trickle down to every piece. First piece, I believe, is having internet access, broadband access, high-speed internet access. So for folks, I mean, you wouldn't be on this call right now. Everyone that's on this call has high-speed internet access, I hope. But this is what is needed. You need internet. You need an internet connection to talk to your provider. You can't just, I mean, it's a terrible analogy. If you can't talk to the sky, it's not going to do anything for you. But you have to have the actual internet connection to talk to your provider. So let's get you connected. So financing your telehealth adventure. There's been a lot of programs, like I said, during the pandemic that were implemented to help folks get connected to the internet. The FCC has implemented several initiatives to keep Americans connected. Some of these have gone away, but you also want to just keep looking at the FCC website for programming and for funding options. They have it divided up in what's expiring in a month, in 3 months, 6 months, and they're always updating it with new programs. And I just want to mention that telehealth visits can range depending on insurance and all that, from $30 to $150 for consumers. It's still an option. It really depends on many factors. Some possible solutions. I just want to shout out to the Affordable Connectivity Program. It was an amazing program that helped folks achieve internet access at a lower premium or at a lower monthly rate. It was subsidized partially. I actually took advantage of it myself. It lowered my internet from $70 to $50. And that was a big boost for me. I mean, $20 is nothing, is like, could be nothing to somebody, but it's a big difference to me. I'm sure we can, I mean, you can have a pretty decent meal for $20, a really, really nice meal for $20, actually. Or you can get like a few groceries. Just joking on how grocery prices have increased over the last couple of years. So yeah, just talking about possible solutions. We have Access Lifeline. Those are mostly for elderly consumers. It's a federal program that helps eligible households pay for internet services and internet connected devices. So take a look at who is eligible. Some folks that are on SNAP, Medicaid, public housing assistance, SSI, et cetera, could qualify. So please go check to see who does. If you have consumers that may fall into that category. There's also, aside from federal programs, there's also local counties and municipalities. They have subsidy programs too. There's at least anecdotal in Chattanooga, Tennessee. There's a company that has caps on how much profits it can make. And then once it goes over those profits, it reinvests the overhead into the community and into broadband infrastructure access. That's just one program, and I know that's very specific to it's Chattanooga, Tennessee. So that's where I used to live, as an aside. But to continue onward, the last solution would be an out-of-pocket solution. But again, if you stay diligent and vigilant on programs, you should be able to find something that fits your needs. So we have internet access now. Now the next roadblock. I don't have any health insurance. That is arguably one of the bigger roadblocks. I mean, we always want people to be covered, but we do know that many millions of Americans go without health insurance each year. And it's a big preoccupation for folks. It's not a great situation to be in. I mean, this is a natural plug, but if you need a healthcare or if you need health insurance, please go to healthcare.gov, check out what they have for plans. Since the COVID-19 pandemic, more people qualify for financial help and lower premiums on health insurance plans. So options are out there. They may not be the most affordable, but it really takes you got to do your homework to find the best plan for you. So we're going to talk about Medicare. Under the list of telehealth services, there were some changes to Medicare legislation. The House Rule 2617, it was the Consolidations Appropriations Act of 2023. It extended many waivers for telehealth, but that goes until the end of this year. So after that, who knows what will happen? But again, like I was mentioning, President Biden is trying to extend in the fiscal year 25 budget more funding for telehealth. But for reimbursement and coverage wise, some important things within that legislation. For location, there are no geographic restrictions for patients and providers. Eligible providers who are all healthcare providers who are eligible to bill for Medicare can bill for telehealth services. And that includes federally qualified health centers and then also rural health clinics. And I know we have a decent amount of them in Texas, and they do a lot of great services in the most hardest to reach areas of Texas. And again, if you want to take a look at eligible services under Medicare, please visit cms.gov. I have it mentioned in here multiple times, but that's your most robust federally sponsored website for Medicare and Medicaid services. And then also within telehealth services, the modality of it can be different. So you can have just a phone call visit. Those are possible as well. So if you don't want to do a video visit and you can only do audio, that is also approved. All right, so just talk about a little bit more about Medicare, going a little deeper into it. We have a thing, Medicare is a thing called an e-visit. What is it? An e-visit it's a virtual visit with your provider that allows you to receive a diagnosis or treatment plan for common non-urgent medical conditions. Part B of your insurance for Medicare covers your e-visits with your doctors and certain other healthcare providers. So you really want to take a look at your plan and what you have. After you meet your Part B deductible, you pay 20% of the Medicare approved amount for your doctors and other provider services. So like I was mentioning, cms.gov, please go visit it. With Medicare Part B, again, you can get an e-visit with a doctor, nurse, clinical nurses, physician specialists or physician assistants, licensed clinical social workers, and clinical psychologists. All right, so now we're going to talk about Medicaid. Medicaid telehealth reimbursement policies, again, it's a very state to state because it's state administered. Most states have expanded Medicaid coverage for telehealth. Telehealth services via telephone, electronic, or virtual means are possible. Home can be originating site for telehealth. Coverage and pay parity for telehealth services is an option, is a thing. And just to explain pay parity for telehealth, it requires that telehealth visits be reimbursed at the same rate as if you had an in-person visit. So they're trying to establish equal care, or they're trying to establish the idea that you get the same quality of care in an e-visit as you do it as an in-person visit. And pay parity is one way of doing that. And lastly, you can do asynchronous telehealth services. Like I was mentioning earlier, although most appointments happen virtually in real time, there's some other options that you can do where it's an asynchronous care, where important information can be shared before or after on-demand visits. And then, again, asynchronously at different times, it can happen for you. So talking about Texas Medicaid, Medicaid is the state-sponsored, state and federal cooperative program that provides medical coverage to eligible persons. The purpose of Medicaid in Texas is to improve the health of people. Again, that's what insurance is supposed to do, is supposed to protect us. So the mission of Texas Medicaid and Health and Human Services, emphasizing prevention, promoting continuity of care. All of this you hopefully maybe know, but if not, I'm glad I'm providing it for you. Finally, providing a medical home for Medicaid recipients and ensuring that each recipient can receive high quality care. All things that should be assumed, but again, it bears to repeat it because we want to be an encompassing resource for telehealth. All right. And then if you want to be eligible for Medicaid, you have to qualify under these certain categories, be pregnant, be responsible for a child 18 years of age or younger. You have to be blind, have a disability or a family member in your household with a disability, or be 65 years of age or older. So you want to check how you qualify and see where you can, because it's very important for people that don't have the necessary means to get certain types of private insurance or Medicare, if you don't qualify, if you're not old enough. So how do you qualify for Medicaid? To qualify for Medicaid, it's always dependent on your annual household income before taxes. That is based on a certain amount of people living in your household. So this is just a mock-up of that. For two people, before taxes, as an example, it'd be $39,046. And there's the contact information if you want to know more about connecting for Medicaid. And then there's an email as well. So talking about Medicaid and telehealth, what does it look like? Providers of Medicaid may provide telecommunication services or that can service for Medicaid. For Texas Medicaid clients under the provider's national provider identifier. This is mostly for providers and how they can bill for telehealth. But I really encourage folks that do have Medicaid to go to this website, Texas Medicaid and Health Partnership, if you want to learn more about where you can qualify and how you can qualify. And in my notes, I do have links to their handbook, their services handbook, and then also just a link to the website as well. So the Center for Connected Health Policy is a super, super important United States resource. It's across the United States, and what they do is they want to make telehealth policy more accessible to everyone, because I can't tell you how difficult certain portions of this presentation was finding policy just finding the most up-to-date policies by state and federally. It's quite a lot of policies for telehealth as it relates to insurance, as it relates to internet access. It all connects. But this website, the Centers for Connected Health Policy, wants to make that transparent. And so what they do is they track it across all 50 states, including territories, all 54 jurisdictions. And what they do is they update it constantly throughout the year. And you can go and look at by states. You can look at Texas and look at all the policies that are associated with telehealth in Texas. And they explain it in very, very easy to digest, information relating to policies. And we're also a resource. If you don't understand certain policies or you don't understand how to navigate the space, we're always here as a resource to navigate. And this should be mentioned too, because we've been seeing it in the news quite frequently as the public health emergency has ended and everything. Lapses can occur at any time and without notice. Usual terminations can happen with address changes, not monitoring your mail enough, and also being aware of their Medicaid and CHIP expiration dates. All of them have expiration dates, and you have to be up to date on those. But also, these are resources to protect yourself, to know what you can and do so far as protecting yourself from losing coverage. Go to cms.gov to learn more. There's also the Texas HHS Medicaid website. Disability Rights Texas is one of our best buddies here at the Texas Center for Disability Studies. They do amazing work. I can't say it enough. Please see your local and state resources that deal directly with advocacy and rights, and disability rights will try to do their best for you. I can't guarantee anything, but they are so great. I can't recommend them enough. And then also there's the Area Agency on Aging, their long-term care ombudsman program. It's a really great program. It's kind of it's almost like a caseworker working with you to get you connected to internet services and to help you navigate insurances and all that. And they're really great resource that's also available to you. So go please check that out. All right. And then the easiest part of insurance is private insurance and telehealth. You just have to see if you have private insurance, like where you qualify, how you qualify. It's always built in. Talk to your provider. It can vary very much from not all insurances are built equally. Yeah. So again, but the one benefit is that many commercial plans have expanded during the pandemic, but they vary. So it's good to do your homework and talk to your provider and see and talk to your insurance as well. All right. So you may not, we've talked about all this, and then we talk about technology. A lot of us we're already on computers and laptops all day. You're on this webinar with me. You're vaguely familiar with technology at this point. But there's a lot of other technologies that apply to, telehealth that you may not know about or don't know how to use. It's just there's a lot of little tools out there that can help you have a smooth or even a smoother telehealth experience. So one thing I really want to stress before any of that is communication, self-advocacy, and access needs. These are always important within any like realm in life, but especially when it comes to healthcare and advocating for your rights in health. These all relate to telehealth and especially your assistive technology. Your assistive technology may not be compatible. Your practitioner may not be familiar with how it works. Sometimes English may not be their first language, depending on who your practitioner is. You may have to switch providers or practitioners or doctors, depending on if they do engage with telehealth or not. And then as a assistive technology user, integrating your assistive technology can present as an important step towards excellency in telehealth. Integration, we'll talk a little bit later, just so far as how it syncs up with a computer or a tablet or phone is really dependent on the devices and the online platforms that your provider may use. And then finally, it should be said that letting your provider know as soon as possible about your needs is always important. And again, in every walk of life, it's what is the saying? Nip it in the bud before it even grows and like grows into something that's uncontrollable and that it turns into a diminished experience within telehealth. We don't want that. So communication always goes so super far, but also standing up for what you need and what you believe is what best suits you also helps a lot. So just a few things is like you want to test your equipment. You're going to do a lot of troubleshooting. You also want to obtain contact information when you're testing out your assistive technology for like support lines or having just any kind of support line email on hand for any technical difficulties. That also always helps. And then again, glitches and malfunctions always happen. So it's just a part of life. Again, going back to doing your homework, preparation is the key to success. You got to create a plan, identify your best funding options, ensure internet connectivity, identify your accessibility needs, test the technology before, verify accessibility of provider telehealth online software. Just want to have a plan. If you don't have a plan for most things in life, it's not going to go how you expect it. So if we could plan for success, we'll have excellency in telehealth. So talking about technology again, if you this is the Telehealth Technology National Telehealth Technology Assessment Resource Center. And what they do, it's a really great tool because they assess telehealth technology and see how and talk about the aspects of it, the characteristics of it, see how it integrates within telehealth platforms. And it's just a really great try before you buy system where they look at things and they can tell you how it may integrate well or not integrate well with your technologies. And it's also like you can go to it and look at if you want certain aspects of a technology, they break them down in a very detailed manner. So I left the hot link and the website in the bottom. And then talking about best practices. So as we're developing and moving faster in technology is rapidly advancing with AI and all that, we want to think about how we're interacting with technology. So a lot of things, as we've seen and kind of in the news with TikTok and all that, people are worried about social media with our youngsters and younger generations of kids. Same goes for older adults and everyone. There's a lot of hacking, there's a lot of phishing within emails and all that. And there's many ways that folks can get tripped up in technology, and it can be more harm than good to them if we don't have that technology literacy. So this is a company called Foundations of Humane Technology. And what they do is take a look at technology and how it's been developing, where it's going, and how it interacts with us. And I think what they aim to do is to just remind us of our humanity as we're interacting with this technology. It's really, who knows what the future holds in terms of technology. You could have asked me before ChatGPT launched, like, is AI going to be a realistic thing in my life? Generally, yeah. It already has been before ChatGPT, but just witnessing kind of the explosion of AI generative tools throughout the internet has been incredibly awesome, but kind of scary. There's always checks and balances that we want to have, and I think not enough people have maybe asked those questions to themselves as it relates to what do I want to use this tool for? How am I using this tool? Is it impacting me in a positive way? Is it interacting with me in ways that is it like cutting corners for me in ways that I should be doing the extra work? It's like ChatGPT, I guess, is mostly what I'm referring to. It can be a great tool, but also, as we've seen in the news, people using it for other means that aren't so wonderful. So it's just really talking about future generations, our attention and mental health. It's always a prevalent topic. We got to maintain our mental health within the workplace and at home. Information environment as well. So again, misinformation is everywhere. We can't get rid of it. It's not going anywhere, especially when we have platforms that are allowing for total free speech. I won't mention any, but there's just anyone can talk about anything that they want on the internet, and a lot of it goes unchecked. A lot of it goes unverified, and people believe certain things that people write. And so this is just a company that is looking and teaching people how to be more discerning within their information access and acquisition. Our privacy and safety, democratic functioning, just being able to move freely within the internet space and not be attacked by hackers, not be attacked by predators, and not be attacked by just bullies too. Internet cyberbullying is such a huge thing and continues to be a super huge thing. And it really affects kids. And it's not something that we should take lightly. I'm spending a lot of time on this slide because I really do believe that if we just take a step back before we take a step forward in all these technologies, I think we'll be better off with it, and that we'll kind of just check ourselves before. It's a really I don't know, dumb saying, but check ourselves before we wreck ourselves. We don't want that to happen, and especially for our kids. Like we want to teach them good values. We don't want to be so fast paced. We want to slow down a little bit more. We're in this attention economy. Everything's trying to buy our attention. Um, we should think about these things, and that's what this company does. All right. So this is the fun little plug for our Texas Technology Access Program. We did this is a smart collaboration between the Capital Area Council of Governments and TTAP, our program. And these are telehealth accessibility kits. So these are kits that you can check out. They're available in our loan library, which I'll talk about in a second. And the contents of them, you can either do a QR code or click the hot links. But for example, you get really cool different types of smart plugs. You get some smart lights that you can turn on and off without a switch. And you can also put a timer on it. We have Ring cameras that are available in the kit. It's a Ring camera or doorbell, so you know who's coming up to your door before you answer it. There's also a smart speaker, so like kind of like an Alexa, or ours in here is the Amazon Echo Show smart speaker. That also can help during your telehealth visits. Also, we have our eventually you get an iPad, not you to get an iPad, you can check out an iPad to also use during your telehealth visits. And then some of the things that are really interesting that I think we need to do more about as people and like body scanning. You also get a distance thermometer. There's also a blood pressure cuff, an oximeter that measures oxygen levels in your blood, and then also an EKG. For folks that don't know, that detects rhythms of your heartbeat. So these are just general like checkup things that you would potentially have to do during your e-visit or your telehealth visit with your provider, checking your blood pressure, checking your oxygen levels, checking your temperature, just very normal basic things. And I think it's a great tool because all of them are great tools because it helps teach you like healthcare literacy on your own and being able to check yourself without a provider. It could go really a long way when you think you're healthy and you don't go to your provider for a checkup in a long time. These can help it just generally test vitals and see how you are in that moment. So it's a good tool to have. It's an incredible tool to have, this telehealth kit. And I really suggest everyone to get the word out if you want to try it out before you buy any kind of these technologies. That's what we're here for. We're a try before you buy kind of program. And I'll talk about that right now. So I have a few videos that I'm not going to play. This video that's attached here, it was done by Angela Standridge, or the TTAP director, the Texas Technology director. So accessing our loan library, again, this is a video that explains it. There's a hot link that also explains it, but we're a try before you buy system. It's a 35-day loan device system where we send you the equipment to test out, and that's all forms of system technology because we cover all lifespans. I think it's Angela's saying is twinkle to wrinkle we cover. And it's all types of technologies that assist folks with disabilities. If you're hard of hearing or deaf, if you're low vision or blind, we also have communication devices, and we also have these telehealth kits. So please check them out. This explains how you can do it. You don't need any qualifications to access our program. The only qualification is that you need to be living in Texas. But we don't look at insurance, citizenship, none of that. You just have to be living in Texas and then just ship it back to us after 35 days. It's a pretty cool system, I would say. All right. So we talked about internet access, talked about insurance, we talked about technologies and telehealth. And now we're going to talk about how those technologies integrate into telehealth and in the form of accessibility. I'm going to take a little drink. All right. So I mentioned I was going to talk more about laws, laws around accessibility as it relates to people with disabilities, um, and relates to telehealth. President Obama back in 2010 signed the 21st Century Communications and Video Accessibility Act into law. It updates federal communications laws to increase access for persons with disabilities to modern communications. It ensures that accessibility laws enacted in the 80s and 90s are brought up to date with 21st century technologies, including new digital and broadband and mobile innovations. And then we also have Section 504, the Rehabilitation Act of 1973. A lot of you folks may know about these, but it's a national law that protects qualified individuals from discrimination based on their disability. And then also we have the Civil Rights Act of 1964, Title 6, Section 1557. That makes it unlawful for any healthcare provider to receive funding from the federal government that receives funding from the federal government to refuse to treat an individual otherwise discriminated against the individual based on race, color, national origin, sex, age, or disability. And then with all this guidance, the HHS Office of Civil Rights and the DOJ's Civil Rights Division, they explain various federal laws making telehealth that require providers to make telehealth accessible by people with disabilities. And also, which I thought was really cool, limited English proficiency persons. So folks that don't speak English that well doesn't mean that they should be denied services or that they shouldn't be able to receive culturally tailored or services in their own native language. And these are laws that help with that, especially within telehealth. So we're going to talk a little bit about some ubiquitous technologies that are integrated for your telehealth visit. Some are going to be computer-based technologies. These are done mostly by Microsoft, Apple, the big platforms that we use, Google, Chrome. All of it may be device specific, but these are things that you want to take a look at so far as enhancing your telehealth experience. So a lot of these, I have a huge list. Some of them are more specific to, like, for example, Apple has the magnifier and point and speak. Some of these are more specific to certain brands, but overall, within accessibility features, within these three companies, you will find an app or something similar to an immersive reader, a narrator, something that can translate, dictation, live captions. We have live captions on our Zoom meetings. There's also co-pilot features. All of these are ubiquitous technology features that they will look different in all different technologies that you access. But because of regulations and compliance, these three companies are really trying their best to improve access for people with disabilities with these accessibility tools and features. All right, so we're going to take a little break. We're going to sit down a little bit, pop a squat, and just kind of break out a little bit. And I would love, if you have your phone right around available, check your messages, see if your loved ones have messaged you. But also, I would love for us to go to our accessibility features on our phones. So if you can break out your phone, go to your settings. Usually your accessibility features are settings. If you're on an iPhone, so you go to your settings, you type accessibility. This is generally what you will find. You'll find options for doing screen reading, visibility enhancements, hearing enhancements. There's options for interactions and dexterity with your fingers, and then also advanced settings. So I would love for everyone to pull out their phones right now and just take a couple minutes and play around with it. And then please, if you could in the chat, just tell me if you learned anything new or if you thought something was cool about some features you didn't know about. Please let me know. So we'll just take like 2-3 minutes. And I'm going to check the chat and kind of talk about and see what folks are talking about. All right. Yeah, Angela was saying that most people don't know how to use the accessibility features. There's a lot of great videos that are being put out by Apple, Android, Google that kind of explain how to access these features. And I would encourage folks to take a look at the notes that are in these slides because they will all help with navigating and going to those resources to test them out. So I'm going to pull out my phone. Now I've checked the chat. Now, for Google Tools, Angela loves the live transcribe in a noisy environment. Musetta Foreman, so glad to see you, Musetta, today. Magnification window, that's what they enjoy. And then I also tweaked my earbud modulation to work better with someone over 50. Yeah, so you can do like audio enhancements. We also have all these tools. So apart from these being built-in accessibility features in your phones, we have tools here that also pertain to those domains that you can take a look at as it means to improving access and living independently for a person with disabilities. So. Yeah, and then Maria says you are right. It's important to explore devices to make them more efficient and useful. So if you're having issues with your phone and you want to make the text bigger or something, those are all possible. I know we kind of can get stuck in our ways as it relates to just getting on with things because it's never going to change. But there are options out there, and that's a little bit like talking about advocacy, but at the same time, it's also just seeing what's out there. If you just explore a little bit, you'll find out more. It may be weird, it may be different, maybe it's scary. A lot of it's scary that we don't know about, but within accessibility features in your phone, there are really cool features that we need. I will need it when I get older. I will need vision enhancements. Just anyone and everyone. We all get older. We're all going to need them. Twinkle the wrinkle. I'm going to keep saying that phrase because it's such a great phrase. But yes, I think it's about been 2-3 minutes. Yes, everyone ages into disability. That's what I'm saying. I will be the second I can get an assisted wheelchair or something when I can no longer walk, that'll be my first thing. I would love to just not have to. I can just roll around to every place if I need to, and that'd be so great. All right, so we're going to talk about video and online telehealth platforms. So all these platforms can look different. A lot of this stuff that I'm talking about right now pertains to education and education materials and purposes. So within classroom settings, but these are good principles to follow as it relates to your access needs. When it comes to HIPAA compliant documentation, you also want to make sure that all of your providers are following these principles as it means to deliver healthcare services to you. So any kind of content that you come into interactions with your provider, you want to make sure all the content is perceivable. And so what I mean by that, the perceivable content will make it possible for all of your learners, including you, to see and hear the information clearly. Also, I'll talk about that later, but operable, you want to make sure that you're able to access it and all of your tools are able to access this content. So again, talking about documentation, if you can't open up a certain document because it's behind you don't have a PDF version, you want to talk to your provider about how you can get certain different types of documentation that are still HIPAA compliant. Again, it's just, if you don't have a conversation with your doctor, nothing's going to happen. So operable content will help all of your learners navigate the information independently using the preferred tools. Understandable. So that's what I was going to get to with perceivable. You want to make sure the content is understandable by the patient. And what do I mean by that? You want to make sure it's in their reading language or their reading grade level. If you have very high complex medical terms in documentation and people don't understand that, you want to make sure that you tell your provider, and hopefully providers are being better about this themselves. But again, self-advocacy is such a thing. I can't express it enough. You got to tell them, hey, I can't understand this, or I don't understand this. I need it broken down for me. And there should be no shame in that. This is your health. It's all important. You need to get the best quality of care possible. And then finally, and then I just want to say, for understandable, consistent, and predictable design, you want to make that's a very important aspect, because if you have consistency, people know what to expect, and it can smooth the whole experience entirely. Um, robust content. Robust content will work for your learners on a range of current and future technologies, including assistive technologies. So robust, you could say consistent, again, accessible. It can be accessed at different points in time. It can be accessed on different types of devices, and it can be accessed then, now, and in the future. So these are just some more questions to consider. I think I can copy these right now. Maybe I can. Let me see if I can post them. No. So questions for the chat. What kind of platforms have you may used? What are the general features of them? What have you interacted with? What have you seen? Do they work? Trying to think of the platform that I use for my therapies. It's a really clunky one. I mean, I'm not too fond of it. It works for what I have going on, but there's always, on my end or my therapist's end, there's always some issue, and it delays the whole process. So it's generally just not my favorite, but I know there's other platforms that I could maybe use, but I like my therapist. So again, what kind of platforms have you used? What are the general features? What are some features that you may want on them? And then have you tried navigating them with your assistive technologies? So that's something just to kind of either write in the chat or think about as we're moving forward. And then we're going to talk about the patient portal. So again, these video online platforms that we're using for telehealth, HRSA, that deals directly with federal engagement in telehealth. They have these videos, these instructional videos that they put out for navigating your patient portal. Please go and watch these videos. It's not a catch-all type of situation with this. Like I said, there's varying platforms and how well they work depends. But this is just a kind of a blanketed video of what to generally expect within your patient portal. So good information, good resource to go check out. And then another video that they did was on privacy and security. It's a great little video as well, because of anything, if we want one thing out of our telehealth experience, is that we want privacy, we want security. We don't want our personal information to be captured by video by somebody in some other way. Who knows how hackers are very creative, and personal information can get out there, especially when we're engaging in online platforms. This video would help with that. So please go check it out. There's another video, kind of shows kind of the different buttons and symbols you may see within appointments and within like a video platform. So options to like type in the chat, a chat symbol, end the call, your microphone symbol, or the video symbol. This is especially important for like maybe older adults that don't know what these mean. This is just a video that helps explain certain aspects within a video platform, kind of the more nuanced features, and also the accessibility features that may be available within these platforms that you can use to your advantage. So, all right, so we're on the home stretch. I see that I'm doing right on time. So we got through it all. We're at that moment of having a telehealth visit. We're sitting down and we're thinking to ourselves, oh man, am I in the right environment? Is this too bright? Is this too dim of lighting? Is it noisy where I'm at? These are all things that you may consider. I would encourage you to consider. You always want to do checks, check everything, check your person. I mean, the idea of telehealth is supposed to be maybe a potentially more casual engagement. Like I mentioned, I can wake up in the morning in my pajamas with a cup of coffee and talk to my therapist in the morning, just on the weekends. Very casual, very light, very nice engagement. With other engagements, you might have to be a little more formal in your presentation. So it's always very much a visit by visit basis, and what the contents of that visit are that may require you to be in a more formal attire versus pajamas. So camera settings, webcam settings, environment and settings, you want to take into consideration the sound, how your framing looks for your computer, for your video, maybe potentially do a Zoom room, or you can also pull up your webcam on your laptop and just see generally like how the framing is for you and if people can see you or not. Because you don't want to be like, you don't want me to be all the way up here and then me be cut off and you can't see me at all. That's not fun to just see a body talking to you. UDL, it should be said that Universal Design for Learning was kind of those core principles I mentioned earlier. That's just being perceivable, operable, understandable, and robust. We want all web accessibility to be present within your telehealth experience. So just check for that. Hopefully you check that beforehand. Computer checks, like I was mentioning, broadband, checking your internet. Maybe it's better that you have an Ethernet cable plugged into your laptop versus doing Wi-Fi. That can ensure more of a solid connection to the internet and also helps avoid interruptions. These are some general tips in the notes that I have, is like wearing solid neutral colors. You don't want to wear anything that's like fluorescent, or you don't want any bright lighting, like I was mentioning, that may obscure your face or just prevent or have a glare. You want to keep your site clean and visually clean. So if you have a lot of clutter around your space, that might be distracting for you and your provider, which could impact your quality of care. And so just checking yourself in a mirror, or just like, do I have any crumbs on me? Did I eat something? Did I just get back from lunch or something? If you have a lot of people coming in and out, maybe closing your door for a little more privacy. We all want privacy, so that's always a good thing to think about. Testing your microphone beforehand as well. In the notes, you'll see a bunch of tips and tricks that I provide for just general best practices for your telehealth visit. All right, so home stretch. Let's review. What do we need to access telehealth? This is the only slide that I have animations on, so let's get to it. So first thing is a reliable internet connection. Second thing is insurance or out-of-pocket costs. Third, you need a provider. You need technology, computer access. And you need to have a little bit of understanding of the process when it relates to health literacy, checking your vitals potentially, and then digital technology literacy, understanding the tools that are available to you so far as assistive technology, so far as tablets and communication devices, the web video platforms that you use for telehealth. All these kind of tie together into understanding technology. And that's not an easy hurdle to get over, but as the true and tried saying is, with practice comes almost perfection, but with practice comes really good results. I really encourage folks to do their homework, practice, and also failing is okay too. We have interruptions. Again, things happen, life happens. But just to sum everything up with a little nice bow on top, telehealth is a great tool. It enables access for all. It has near limitless potential for the future. It can help bridge health equity. It can connect communities, especially communities that have limited access to broadband and health services. It can promote health literacy within patients. And then it also allows for the ease of access that can be a superior option for some consumers. All of this is evolving fast, and it really takes our due diligence to keep up with the times. Unfortunately, that's just how we're built today. It's the responsibility of everyone to stay up to date when it comes to your insurance, when it comes to technologies, internet policies, and the greatest innovations in technologies is we gotta. It's a lot to keep track of, but we're also here as a resource to help you with that process. And then finally, the bare minimum that's going to get you anywhere and everywhere, advocating for increased access for not just yourself but for others. If you know people that would benefit from this that can't access this, let's talk to them, let's engage with them and see what they need, what they can't get, and I'm a firm believer in that there's always an option somewhere out there. But it really takes us to come together and not be so separate and siloed to really try to make things happen. So that's what I mean about advocacy. And then finally, there are a lot of things you can't control. Like I mentioned, life happens. So these are the resources. These are the bits, the good stuff, our dessert. So this is a local patient resources. This is the Texas Department of State Health Services, DISHES, the TCHAT program, the DelMed TCHAT program. They work with school staff members this is more like behavioral health and mental health, and it's mostly geared towards students. But I think I should mention it because just having more resources for students to thrive, it's vitally needed. I feel for the teachers, my teachers that I know and the teachers that I don't know. It's really rough in schools in general, but like nowadays, like a lot of teachers don't have support staff and don't have support in general, especially my special educators, shout out. This is just another program that can really help people, especially educators, when it comes to behavioral and mental health of their students. And then the local regional Texas or telehealth resource is TextLaw. It's the Texas Louisiana kind of combined telehealth resource center, and it's a HRSA funded organization. And I'll kind of go into a little bit more about that in a second. And then also you have the Texas Technology Access Program. We're always here. You can always give me a call. I would love that. So these are some national resources. Please check them out. We have the American Telemedicine Association, the FCC, the National Consortium of Telehealth Resources. That's where TextLaw is based out of or is based within. And I'll go into more detail after the slide. And then also HRSA, again, the federal government Health Resource Service Center, Office for Advancement of Telehealth. These HRSA is looking to get telehealth into every part of American life. So as I was mentioning, these TRCs, they are available regionally in all the United States. You can go to their website to find out what region it applies to you. The Telehealth Resource Center has been established to provide assistance, education, information to organizations and individuals who are actively promoting or are interested in providing healthcare at a distance. So that you can see here in the mapping, there's different coloring for different regions. So go check it out. And they also have other resources for not just patients, but for providers as well. They also have like navigation toolkits as well. I gotta stand. I can't not stand on the pillars of these resources and not mention them because these also help contribute to this presentation. So again, more national resources. I'm gonna let somebody in. Just more resources at your disposal. Please go check them out. Some awesome ones are the California Telehealth Resource Center. Again, check out TextLaw as well. But there are other places that, while they're in different regions and different parts of the United States, they may apply to you. They may apply to a loved one that you may know in different parts of the country. So yeah, we have the National School of Applied Telehealth Rural Health Information Hub, which I love. I get all my newsletters from them in regards to rural health information throughout the United States. Highly recommend. They're a great little website. And yeah, and then for veterans, there's the VA telehealth services. So telehealth.va.gov. I think that's an important thing to mention for veterans. More telehealth resources. The Wyoming Telehealth Network is really robust, really awesome. They're also a USED. So, as an aside, we're a university center on education on developmental disabilities, and this is another USED in Wyoming, and they put out this telehealth network, and it's a really awesome one. Doesn't apply to our region, but they have a lot of great information for providers and patients. And then there's also Family Voices, Voces Nacional or National, and they talk about los aspectos básicos de la telemedicina, which is an important, I think, putting out other telemedicine resources in other languages is vital. And if you dive into these resources, you'll find resources available in many languages. Okay. So now we've gotten to questions and comments. I made this a meeting because I wanted folks to engage with each other and really just talk about their experiences if they would like, or whatever they would like. I'm here to kind of take questions, take comments. The QR code is right there if you want to just scan it on your phone. This is just an evaluation from me and our center. This just really helps so far as what you think of the presentation today. Maybe what you want to see for future presentations, and just how I did. So I hope I did right by y'all. I really appreciate you being here today. And yeah, that's going to do it for me. I'm going to be here. Like I said, we were going to finish up well before 11:45. There's some space now, hopefully, for us to kind of engage with each other. But yeah, I really appreciate it. Okay, so just looking at the chat again. Thank you, Angela. Yeah, big shout out to Angela. She's been my #1 mentor in all of this space as it relates to AT, as it relates to telehealth, as it relates to disabilities. She really has brought me along. I tell folks this has been a 2-year journey. In August, it'll be 2 years here at TCDS. And a lot of my first year was a lot of unlearning and learning and just sitting and just soaking up all the excellency that Angela provides for us at TTAP and at TCDS. So thank you, Angela.
Hey, Nico.
Thank you. Yes.
Earlier on in the chat, somebody asked at the end, could you please pull slides 24 and 31 up again? And I will say also that the slides will be shared after the end of the presentation.
Yeah. 24 and 31.
Yes.
Yeah. Cool. Okay, cool. I'm so glad somebody's wanted these, because I didn't know if I should have put these in here, but I think they're always important. Just like these are services. Go take advantage of them if you qualify. So this is 24. And yeah, to the folks that want access to these slides, I will send them. I'm hoping tomorrow in the afternoon. I can get them out to you. I have my other presentation tomorrow to providers, so I'm going to try to do both tomorrow afternoon. So this is 24, and then it was 31. Yeah, yeah, just general. Do your homework. We all got to do our homework to function and do things. We have our daily upkeep of things. So thank you, Ilda. Yeah, just looking at all these. Thank you, Angela, for posting all the accessibility links in the chat. Y'all have been such a great support. So there's slide 31. Going all the way towards the back end. I'm hoping everyone was able to access the survey, questions and comments. And then the last slide, I'm going to post the link in the chat real quick, but the last slide is just a thank you. Oh, thanks, y'all. And let me grab that Qualtrics link. Maria says the huge and innovative new technology is amazing. I take time to learn, accept this different way to have medical appointments. Everything is possible, and it shows how everyone can be included in their own rhythm. I love that little piece at the end. The own rhythm piece is like people do have their own pace that they go at in life, and we should all be tolerant and accepting of people's different paces and different approaches to things. I don't We all have our specific approaches. Some work better for me than others. And on the other end of that, there are other people that have their own methods that work best for them that wouldn't align with me. So I think, yeah, I think that really expresses tolerance. So thank you, Maria. That's what we need so far as getting equitable services, health services for folks.
I just
Hi,
came
Ann.
in late.
Yeah.
Hi. Hi. Hey, so I just have to say that as a person with a cognitive disability, I find the fact that I have doctor's appointments on telehealth just the most frustrating thing ever. And one of my doctors is worse at technology than I am, which is always makes me feel better.
Yeah, I'm not shocked by that, unfortunately. It's
But sorry.
no, go ahead, go ahead.
Well, it actually makes me feel better that I'm not the only one, but I also have a lot of anxiety about the not being able to get on, which increases the difficulties, if you will. And I just got on, my phone reminded me, and I was at whatever, but I just got on, so I'm going to be excited to look at the slides.
Mhm.
And I have to say that I was like, oh, that's a way that they could help me with accessibility. So I was really excited that even though I've known about your program for years and have been out where your program used to be, maybe not still after COVID, it was kind of like an entry point for me. Oh, they would have resources that would help me solve this major problem, because with a head injury, I have 9 doctors at
Mhm.
least, right? And when I was just trained in practices. So thank you very much. And I'll be looking forward to the slides.
No, and I thank you, Anne, for that. I can't imagine having 9 doctors and trying to have them all on one coordinated health plan for you. And the miscommunication that probably can happen between all that, like that's quite a monumental feat. That's incredibly challenging, I can imagine.
Well, and on at least on at least 3 different platforms. And I have to tell you that my primary care doctor, I've just had to work with her for a letter for jury duty to excuse me from jury duty. And while I've trained the most on outpatient, I think that's the one. I just said, hey, you're just down the street. Could I just come pick this? Could you print it out and let me pick it up? Letters up. So I'm still using very this way, and they're wonderful. They're, of course we could come
Good.
get in your horse and buggy and come out.
I mean, if it works for you, awesome. And I'm super glad that they're being accommodating. I mean, these are things that should just be a given. But again, like I'm glad you're saying something that you're not just like, oh, I have a problem, I'm gonna have to just live with it. That's just my life. That's not how it should be, and it shouldn't be like that for anyone. But unfortunately, it does happen. So I'm glad you're able to get the paper copy at the very least. Like, got it in your hands. But yeah, I mean, we're able like I'm not sure what it looks like so far as like educating providers. I mean, that's why I have the telehealth presentation tomorrow. Um, but if there's any ways that we can help you and support you with supporting your doctors and making them understand your technologies and your needs, we're always here to help with that too, and kind of like create a dialogue. Um, but also, I will say it does take a little bit of effort from the providers. It's a two-way street. It's a bridge. We have to connect the bridge. Just like with people, the providers should want to learn more. I know they're really busy. I know they have a lot of things to do, but to deliver the best quality of care for our patients, which is what they want, they should be adaptable. That's just my thing.
Well, and with 9 or 10 different doctors, it's all across the spectrum of what I can expect from them. So
Yeah.
that also increases the complexity for me.
Yeah, that's incredibly nuanced. Like I'm trying to like because I have type 1 diabetes. So for me to have a coordinated health plan with just like 2 or 3 doctors and nurses is incredibly tough. So tough. I can't tell you how often I've sent like prescriptions to my pharmacy to be updated and validated by my doctor, and then for me to not getting I didn't get any notifications, and then the prescriptions didn't process because my doctors didn't get the fax or they didn't get the communications from my pharmacy. But then my pharmacy says that they didn't get anything from the doctor, so it's like a blame game between the provider and the pharmacy, and it's just like I don't I'm not I'm a patient. I'm just one person. Please just figure this out. I don't want to have to like tell 2 kids to stop fighting each other. Just like figure it out. So
Well, and I'm just going to go further. I have a really good pharmacy for that reason. But it's that they're communicating with the doctor through fax, probably, right, sometimes. And so I feel like it brings up the spectrum of, and with a cognitive disability, it's like I don't text well anyway, right? Or I don't use a multitude of technologies. For cognitive reasons, I need to limit it to a couple. And yet, with this incredibly important resource, right, of my health, right, which will determine how well I can use technology, right, in the balance. And I feel like a lot of people don't understand that if you only have one doctor, like I would have had maybe not, or 2 different doctors, but that because, and I've talked about it at South by Southwest, that when you're sick and you have a lot of doctors or are sick or have some kind of chronic health condition, and this is the technology you use the most during COVID, and yet they're often trained the least, and it's overwhelming, and it's just too much. So yay, you all for having this program to help me sort through it better and hopefully be able to use my health technology in a way that supports my health even more.
yeah, no, I'm 100% happy to. I mean, that's like why I got back in, or why I went back to school for health and all that. It's like because I saw a need during the pandemic and I wanted to do something. I wanted to be something. So always happy to help you navigate that system and everything. And like another example is like having documentation apart from reading level. I didn't mention it, but like breaking like paragraphs up and making sure it's like a few sentences and like not run-on sentences and not huge big blocks of text is like that's easier on the reader as well. And that goes for like all people. Like it's just having big blocks of text is very overwhelming, and like for me, like my eyes glaze over. So that's just another aspect of like how providers could be more,
The chunky,
yeah, and
the
just providers
space and the chunky, yeah.
and the text and all that, yeah. So it's just
And
it's very nuanced.
if you don't mind me going on and say this, and I find it, just, oh, we'll go to your portal. Well, can I get on my portal today?
Yeah,
Right? Or or I remember when we had some kind of situation where my phone service didn't go through, and so I couldn't even call the doctor to say I can't get on because I can't get on and I can't reach you by phone to get your support, right? And the anxiety that I felt affected my whole day, right? It was
Oh my
such a
gosh.
traumatic.
Yeah, anxiety attacks can ruin your whole day. Yeah.
And so rather than, oh, I'm gonna check in with my doctor just to make sure that in that situation, I think it was some heart issues. I had all kinds of increased stress and
Undue stress. Yeah.
undue stress. And perhaps you felt this way, but for me, if I'm successful at doing something, I'll learn how to do it better. I'll consolidate the memory of this is what I do, and I have a success at the end of it. Check, right? But the opposite of I couldn't do this, and then I got more anxiety, and I got more anxiety, and then I couldn't reach the office to tell them that I was trying, right? Then that cements I am not successful, right? And the next time I'm like,
Mhm.
oh my gosh, right? Like we
There's
all
a
know that
tendency.
we
There's
build
a
better, yeah.
there's a tendency for providers to put the onus on the patient, and it's just it can't be like that. It really cannot. Like, especially when it comes to inconsistencies in technology and technology failing us, there needs to be more understanding. And I don't know how to get that through to doctors, to tell them that, like, when you've met one person with a disability, you've met one person with a disability. They're everyone's unique, everyone has their own needs, and it really, like, if you don't take the time, care, and attention to show somebody that they feel valued and they feel seen, especially when it comes to the disability community, it's the utmost. It's really like that is what we want. This is what we need, to feel good, and like to not feel like we're the problem, we're the issue, because we're not.
And I have to say that in that case, I did end up talking to their office staff, and they were the model of, we know you're trying, Anne. Even though you could not connect, we know you're trying, and we have space in our practice to reconnect with you at a time that isn't interfered with. And that creates the positive loop again. Like, it may have taken 2 or 3 days to have the doctor's appointment, but I did get the health care I need. And I didn't get rejected from the health care that I need because of my disability, which is a very negative, especially in cognitive, is a very negative loop to feel like, if only I didn't have this disability, I would be able to get the information I would need about this disability.
I can't tell you how many times that negative self, not negative, but that like thought loop has gone over and over in different scenarios, not just healthcare settings. It's like, if I didn't have this, if I didn't have diabetes, I could go and travel the world and do all the things that I could do. It shouldn't. I hate that we kind of have those thoughts, or like we think about those things, but it's because of the pressures and expectations that society puts on to people. And it should be the other way around. We should be able to demand these things. We should be able to advocate for these things and ask and get what we need.
Sort of, now I got to go to my support group to talk about the fact that I couldn't get one right now. That's added a chore to, or talk with somebody about it. I don't mean to be doing all the talking. I perceive that you were close to the end or whatever, and
No,
so
no. Well, we were built
if
in until 11:45, so we're still well within range. How I outlined it was that folks could come and go as they needed.
Okay.
I was gonna finish before the whole time of the event. So the last part was just for discussions and questions and comments. So no, this is great. I'm glad you're talking
Well,
about it.
can I say something else? So with the cognitive disability, I have low brightness on my computer, and I have I often get rid of color. I go in grayscale.
Mhm.
And one of the things I found that just getting on signing up was helpful for me, because you have the question, do you have any questions about getting on? And I have always had the problem of diagnosing when a website is poorly done, whether my problem is in Zoom or my problem is hardware, right? Needs that I need to look under settings, right? And so you had um this thing saying any questions, and I was like, I gotta call these people for questions, right,
Oh
right,
yeah,
right. And then
we
I
can help you
found
out.
out
Yeah.
that it was actually the Zoom support group, and I was like, I've been looking for this for years, how to talk to Zoom about the fact that oftentimes it is a problem in Zoom and not in my settings on Grayscale, right? And I'm often feeling disabled over Zoom because I'll hit some button or try to get on the chat or something like that, and it wasn't accessible in Zoom. And so now you can't talk on telehealth because of something that isn't even the telehealth, it's the in between,
Mhm.
right? And that gives me anxiety to not just put it in chat. My chat won't work, right? Or I can't get my chat in black and white to work right now.
Mhm.
And so I was really grateful for both the resources on that the chat on Zoom gave me, and then some information I'd never called. No, I never could figure out the question I wanted to ask Zoom at the time, but just to see that other people with low vision and cognitive disabilities and were saying that they were having accessibility issues over Zoom on Zoom was incredibly validating, that I am not the only one, which is often how it sits on me with a cognitive disability. It's me.
Yeah, the onus always falls on the patient, and it shouldn't be that. And like, again, the troubleshooting you've had to do and all that, like, is it have to do with my computer? Does it have to do with the settings, and or the settings on Zoom, or is it an accessibility feature or something? That can cause so much anxiety and just like frustration. And for me at least, like we all, well, no, for all of us, we all have our frustrations and like problems that we encounter in our day in and day out. And it's just like having one less is like such a relief. And to maybe have, when things compound and just build on each other, it can feel suffocating. And I sometimes I just don't know what to do. I'm just like, my hands go up. So yeah,
And
that's
I didn't budget time for a half an hour of frustration
that,
in
yes,
this
exactly.
day, right? And I just saw the chat. Yes, technology has done a lot for some people, but with my head injury, I was told by my son in school, I was told by all my doctors, get off technology as much as possible, move to paper as much as possible. And I will tell you, like Tristan Harris talks about, that my brain has gotten much better during COVID because I was cycling off technology. But it
Mhm.
also means that I'm now trying to catch up with a whole lot of growth in technology that I perceive other people know by the back of their hand. So it's been both
That's
incredibly helpful and also not without cost.
That's beautiful, and thank you for mentioning that. That's like, because you'll see in the presentation that I have earlier, or the recording, I do talk about like humane uses of technology and the importance behind just injecting the humanity in our technologies and how we use them, because I think we do need to take a kind of a step back. And I know people did kind of unplug and unwind during the pandemic. And I think it really helped that, like, most of the pandemic I would do without. I hated it, and all of us did. I need not say any more about that. But one part I did like was that we did slow down a little bit more, and technology wasn't so integrated into our lives because we didn't necessarily need it for the certain aspects that we did. And I think that there was a benefit to that. I think going outside more, doing things that don't require a device. I have to have my phone on me all the time to check my blood sugars. That's something that I don't really care to have. I don't like having devices on me. I don't like being connected to my phone all the time. It's something that if I had the choice to, I would do away with it. I would honestly, after my iPhone, I would love to go back to a flip phone. I know it's not realistic and it's not really possible, but at least in my situation, and if I didn't want a glucose monitor for my diabetes, then I could just do finger pricks. But those hurt. Those aren't fun. So I like having a monitor. It's easier for me. It allows for an easier way of living. But that just means the consequences. I have my phone on me all the time. And so like my attention is everywhere. It's always being bought. It's always being trying to be advertised to. And so just like, yeah, I love that you took a step back. You were more deactivated than plugged in. But now, yeah, as 2024, AI is the it's the shiny new toy. It's the sweet little Corvette or Cadillac of cars nowadays. People really like it. People love it. It's a great tool. It helps with efficiency, it helps streamline things. But at the same time, I think there's not a lot of checks and balances that are being developed. I mean, they are, but is it happening at the pace that technology is developing? I'm not sure. And so it's just like how we use technology is so important. Just asking those more fundamental questions, I think, can really help us and benefit us. So.
Well, I'm going to second what you're saying. I feel like so both my brain is better, so my new learning is faster, and my ability to concrete think, which is what you need, and integration is better. So my ability to not get frustrated has increased. At the same time, I was doing working with the Brain Injury Association of America lived experience group, still leading that, and I was working with the Agency for Community Living in Washington. And so I had this frustration of I can't just go walk into a building and talk with them. And it did help me sort of say, I got to get more centered in Texas where I can, bring what I know to Texas where I can go walk into a building as a substitute for give up on this technology. And so I feel like the costs and benefits here, that it is a trade-off and that it's a personal trade-off of what's best for me, given who I am and what my needs are. And that's really empowering when you can get to that place where I can come visit you. In fact, we should set. I can drive.
You can
come
visit the center. You're welcome. Yeah, the center. We can set up a visit and everything. But I do love what you just said there. I do think like that the gift of choice is so not missed upon like myself and others within the disability community. Just having choice is what enables us, gives us independence, gives us freedom. And I recognize that like living here in the United States, it's not always equal, but it's better than other places. And I also have to recognize that my situation is better than others that have diabetes. it's a checks and balances. It's not like a comparing and like I have this, they don't have that, but it's just trying to stay humble about the situation. We're working with what we've got. We're working with our providers. Hopefully they're working with us. If not, let's get some people that want to work with us. And just like understand, I think that compassion piece can be lost a lot of times. And I'm trying to bring it back and just keep it going.
I like that, and I would use the word self-empowerment and self-advocacy, because when you're successful advocating for yourself, you know that you can be more successful next time. So building executive functioning that way. So there are a lot of positive benefits when you can understand that you do have trade-offs, right?
Yeah.
And that that one can exercise them to one's benefit.
I totally agree. And I think on that, I'm not going to say anymore. I'm going to end it on that note, Anne, because this discussion was beautiful, and I really appreciate you coming off mic and sharing your story, because it really contributed to this presentation. So,
Okay.
I will send it to you. I will send it to everyone that's still here. I'm hoping to get it out by tomorrow afternoon.
No hurry.
Okay. Well, again, Anne, do you have my contact information at all? Email or all that? It'll be in the presentation.
Kathy Keller will be able to give it to, or can you shoot me an email with your contact information? That would be great.
Can you write in the chat real quick?
Oh, let me see. Team chat? Is that where I go?
No, it's the Zoom one. If you're not able to find it, I can just type it right now.
I'm Anne with an E and Forrest with 2 R's. You got that? And my phone number is 703-855-8136.
703-855
8136.
8136. And then your email?
It's AS like in Susan, FORREST @gmail.com.
And what I'll do is, because this is your personal information, we're still recording, but I'm going to delete this portion of the recording.
Okay, thank you.
Yeah, so your personal information doesn't go out.
Thank you for being sensitive to that.
Yeah, of course. Because it happens. Let me
I
see.
don't want to be flooded or not flooded. I don't know, but thank you.
Yeah, of course. All right, I got it.
And the safety concern, I feel like that's the other thing about technology is what are the safety concerns about doing something? So thank you for being sensitive to that.
Yeah, no, it takes that checks and balances and asking ourselves the right questions. So, everyone, thank you so much for being with me today. It's been really awesome. This is the culmination of a couple of years of just learning and developing myself. So I really appreciate y'all being here today. So, and yeah, thank you, Musetta. I hope you have a great rest of your day. And Maria as well, and Linda, thank you again. So I'm going to go ahead and stop.